Thank you all for joining us today. My name is Sara Anderson. I'm the Executive Director of the Bay Area Global Health Alliance. The Alliance is a membership organization connecting academic institutions, biotech, tech companies, and other private sector companies, as well as NGOs serving the most vulnerable around the world. Our goal is to catalyze innovation and equity in global health. And the purpose of today's conversation is to take a scan of COVID-19's impact on other global health priorities like maternal and child health, AIDS, tuberculosis, malaria, and others. We also want to explore what we do with this historical moment in global health and explore the profound impact this pandemic will have on global health moving forward. I'm very pleased to introduce our panelists, three amazing experts in global health. First, we have Mary-Ann Etiebet, who is the Executive Director of Merck for Mothers and serves on our Board of Directors. Merck for Mothers is one of our catalytic funders and founder members. So we're very pleased to have Mary-Ann here with us today. We also have Loyce, who is the president of the Global Health Council, and the Global Health Council is another sister member of the Alliance. And we also have Chris Collins, who is president of the Friends of the Global Fight Against AIDS, Tuberculosis, and Malaria. All three are titans in global health, and we are thrilled to have them join us this morning, especially as so many of them are so busy, as I know all of you are. We are also joined by Ben Plumley, another global health leader and host of Shot in the Arm podcast, and my co-host today, who will be serving as the co-moderator this morning. Ben, you want to welcome everyone?
Thank you, Sara. And I do just want to welcome everybody to this webinar. And I think the conversation is going to be fascinating and really interesting as we look at what are the big ideas in global health coming out of the crisis of COVID-19 and what it demands of us. So what I'm doing is acting as the host of the Zoom call. All attendees are on mute. If you have any questions, and we would love questions from you, please use the Q&A section in the Zoom to ask those questions, and we'll put them to our panel. And you have Sarah's email address if you need to contact us that way. We will have a discussion with the panel and then move on to some questions and answers. So let me hand back to the Executive Director of the Bay Area Global Health Alliance, Sara Anderson, to kick the discussion and kick the comments going.
Well, thank you so much, Ben. And I am just going to kick once again to Mary-Ann to start the discussion from Merck from Mothers. Thank you.
Great. Thank you, Sara. Thank you, Ben, Chris, Loyce. I think this is such an important conversation to have right now. For those of you who don't know Merck for Mothers, we were created back in 2011 when the CEO of Merck, Ken Frazier, committed $500 million to helping end preventable maternal deaths worldwide. And as we look towards 2030, which I think all of us are looking towards 2030 or have been looking towards 2030 as the targets for the Sustainable Development Goals, and faced with COVID right in front of us, I think we were all thinking we would move into 2020 as a decade of action, a decade of acceleration for these global goals. But the fear is it's going to be a decade of picking up the pieces. For maternal health, we've always said that maternal health and maternal mortality more specifically has always been a vital sign of health systems and a vital sign of society. And we're seeing the COVID pandemic also illuminating where the failures and the weaknesses, the fissures, the inequities in our health system and in our society are. In the US, for example, and we're seeing, after China, after Europe, and now the US, at the beginnings of the pandemic before sub-Saharan Africa, we've already seen COVID illustrate the huge disparities that had previously either been hidden or just not paid attention when it comes to health outcomes. In maternal mortality, Black women in the US are 3 to 4 times more likely to die than white women. And we're seeing that disproportionate impact of COVID on communities of color, immigrant communities. I live in Brooklyn, volunteering, in a hospital here, and it's so overwhelming and so stark, how differential an impact this pandemic is having in this country. And I think when we expand our lens to the global space, I think my fear, and I'm sure the fear of, all of the co-panelists on this webinar, is that devastation is going to be even more imaginable. We've been hearing from our partners on the ground that women, one, don't know what to do. They're scared, they're anxious, they don't know how COVID may affect themselves, their pregnancies, their childbirth, their children. They don't know where to get the right information and the accurate information. And then they don't know how to, or they're unable to access services. So whether it's due to the lockdowns or shelter in places, they're not able to get critical antenatal or delivery care, or even they're not, if those facilities are open, they're not able to get to them because of lack of transport. So we are already hearing of major issues in the ability of women to access services during this time. I would say the other thing that we're hearing from our partners, especially partners that may not be fully integrated into government and public health systems, is that they are finding it difficult to be part of COVID responses. About 40% of women across the world get their care, family planning, and maternal health care from local private providers. Those folks also need personal protective equipment. They also need to know how, to make their facilities, infection controlled. And there's huge opportunity to better integrate all of the different parts of the health system, whether it be public, private, or community, civil society, so that we're bringing not only all of those contributions to bear, but we are serving all facets of the population who are interfacing with those sectors. So I'll stop there because I want to hear from more folks and have a discussion.
Thank you, Marianne. Loyce, would you mind giving us some of your ideas?
I don't mind at all. And thanks again to Sara, Ben, and the Bay Area Global Health Alliance for having me and all of us today. And congrats on y'all's official launch. I know I met a number of people over the years that I've been with Global Health Council and talked to you all about what it is you're trying to do in an important part of the country and with a critical set of stakeholders. So just very glad to see the Alliance's work is underway, and just know that those of us out here in Washington, D.C. stand ready to support you in that work. To that end, a couple of things I wanted to share today about how we're looking at the COVID response. Again, Global Health Council is mainly an advocacy organization. We worked to convene partners or organizations across the global health community, from AIDS to Zika, really working on these areas that we all care about. A number of our organization, corporation, and academic partners are doing work on the ground in the places that Marianne mentioned that we're really concerned about. We're really concerned about this wave becoming a tsunami when it comes to the pandemic in low and middle income countries. And it's just something that we have yet to see. But as we we've heard from Dr. Tedros, he fears the worst is yet to come. So that's a message that we're giving to Congress, and that's really the crux of our work right now in this moment as Global Health Council, is really convening the community, including people like Chris, who's also on this call, to communicate that message, to help elected officials understand what the opportunities are for the current outbreak and response, but then really have an eye towards resilience. And what I mean by that is looking more closely at health systems that undergird all of the work we do. And as Marianne was saying, you have women who are still having babies. We still need vaccinations. We still require people to be on HIV meds or TB meds. And we are already hearing of stoppages and stockouts and other delays or issues with those programs and interventions. And so what we're fearing is a ripple effect. And that certainly will be detrimental beyond the COVID pandemic, and something that we really are worried about seeing. So we've been in constant communication with people on the Hill, staffers and members alike. The U.S., of course, is dealing with its own crisis and very focused on both the public health and economic fallout. And so what we're trying to do is be mindful of that, but still remind them to see the big picture and address really the root causes of how we got here, which again is a global health problem. We are happy with some of the funding we've received in recent bills or agreements, but we, I think, are concerned that Congress has yet to really invest fully in global health and health systems in response to the pandemic. So we're hopeful our advocacy will be effective over the next couple of weeks as they renegotiate even more deals. But that's really what we're focused on now. Beyond COVID, though, I just wanted to spend a couple of minutes really talking about the medium term, if not the long term, right? Because we are in a moment where the spotlight is on global health, and I've talked about this with a couple of people over the past couple of weeks or so. But the reality is, I mean, now my mother knows what I do for a living. She really understands that, right? Now my sisters understand what I'm doing for a living, and I think we can all relate to that. Whereas now people really do, if they don't understand it fully, they know global health, and we have the world's attention, and we have the attention of people in this country, not just policymakers, but the general public. And so it's something that, you know, while it is tragic, there's an opportunity for us here. And there's almost an obligation that we as advocates and practitioners, for that matter, or investors or concerned citizens, really use this moment to help people understand what can be done from this point forward. And this isn't a new idea. I mean, this is something that we were talking about following the Trump election and looking at the wave of congressional leaders that came in 2018 as an opportunity to revitalize our agenda, to refresh our narrative. We, as global health advocates, I will admit, I think rested on our laurels for a while and sort of took for granted that we would be able to sustain some degree of general public support and bipartisanship in perpetuity. If we look back to the Bush years and PEPFAR and other banner programs, I think we all expected that U.S. leadership and legacy to remain over time, and yet here we are. And so we have been wanting to rebuild that agenda, refill that pipeline for the past couple of years, and we've been looking towards yet another potential congressional wave, whatever side of the aisle, in 2021, just given the political nature or context right now. But then COVID happened. And so I think that this presents an even greater opportunity and a sense of momentum for us to really be bold and not just say, okay, this is what we have been doing and this is how we should sustain that work, but rather, well, if we were to rebuild this, and if we have to rebuild this, what would we do instead? How would we revisit our investments and programs in a way that will keep us from enduring this again, right? No one wants to continue playing this game of whack-a-mole or otherwise be in this vicious cycle of of responding to the next global health emergency. Ideally, we can all, in the US and abroad, sustain the shocks that come our way and really do right by the people we're trying to serve. So I can say more about that later during Q&A, but I think I'll stop there for now in terms of how we at GHC, again, with members like some of you on this call, like folks in this panel, how we're envisioning the future of global health, both today and tomorrow.
Thank you, Loyce. And before I hand back over to Sara to introduce Chris, just a reminder to our attendees that you can use the Q&A button at the bottom, sort of center right of your screen to ask questions of the panelists once we've finished the presentation and the first Q&A interaction. So feel free to use that and type your questions in anytime now. So Sara, back to you.
Thank you, Ben. And thank you, Loyce. That was amazing and really appreciated that. And I loved how having it come right after Marianne of kind of telling us what we were seeing on the ground, both here and abroad. And I would like to now have Chris give some comments, and then we'll move into more of a discussion.
Hi, everybody. Thanks so much for including me on this webinar. And particular thanks also to Loyce, who's really been leading an effort for over several months to bring the community together and think about where we're going in terms of our Global Fund advocacy. It's been a great process, very inclusive, and I think in many ways now is the moment, as she was saying. So I'll just speak a little bit about my perspective. I work largely on the Global Fund and the responses to AIDS, TB, and malaria in Washington. Just so you know, the Washington context, Congress is passing what they're calling the Supplemental 3.5. Supplemental 4 is expected to come up in May, maybe early or mid-May, and this is expected to be another huge bill, trillions of dollars, and it's also probably our best shot to get new global health investments. So just fast forward on my presentation, I would say where I'm going with all of this is to really encourage and support everybody in reaching out to elected officials and say, we really have to have a major global component in this supplemental on COVID. There has been, as Loyce said, some global funding so far in some of the supplementals, but not anything really big, not anything in the order of magnitude we need. So we really are going to need people and organizations to weigh in with Congress right now and say, I really want to see global health in this next supplemental. I think it's going to be important for all of us to also communicate what we're hearing through our own work about the impact that COVID is having in Africa and elsewhere in the world, but also the impact that it's having on AIDS, TB, malaria, and other programs. This is a reality, it's not a story, but we need to tell that story now and on an ongoing basis to policymakers because there's a great deal of pride among policymakers in Washington in terms of their investments in global health. And all of those investments are at risk now. All of that progress on the 3 big epidemics and in other areas, and in vaccination is at risk. And they need to understand that, and they need to be reminded of that, because as this crisis in our own country continues, there's every possibility that they'll forget, and they won't fully appreciate how they need to be responding on a global level too. What we're seeing so far is a really worrying signs about AIDS, TB, and malaria responses getting knocked off course because governments have switched attention to COVID. A lot of public health expertise in Africa and elsewhere has switched to programs. We've heard stories about AIDS, TB, and malaria programs being stopped, resources shifted out of them. As you probably know, WHO came out with modeling today showing the real potential for severe disruptions in insecticide-treated net campaigns and access to malaria treatments in sub-Saharan Africa because of what's going on. TB case notification in India has dropped 80%, and that is not because TB suddenly disappeared. It's because that system's falling apart in terms of that public health system. And there's so many ways in which we need to think about adapting our programs to the era of COVID. Think about HIV prevention, for example, and services for adolescent girls and young women, or key populations groups like sex workers and LGBT folks and people who inject drugs. Those are not prevention programs that are typically delivered by Zoom. I mean, these are interventions where you bring people together and you try to address the context of people's lives. How do you do that good prevention work in this current world with social distancing? And a huge risk around community health workers, who are so absolutely essential to getting services out in so many places in Africa. If they don't have the protection, they're, all the PPEs that, and with refresh every day, if they don't have that level of protection, they're at risk. And frankly, other people are at risk of them helping spread the disease. So an absolutely urgent need there. We also need to remember lessons from the past. For example, Ebola in Western Africa several years ago, more people wound up dying from malaria than Ebola because the malaria program shut down. So there's huge danger here in terms of human life and the disruption that could happen to programs. Loyce has talked about what she's been working on to bring our community together, and I think thinking big in that big new idea about where we head is, again, the time is right. I think it's great. I think for me, as we move forward and think as a community, where does the U.S. government go on global health? We've got to think about not lose. I mean, I think there'll be a lot of interest in more horizontal programming, more health systems type approaches, and I think that that's good and fine. And I think as we do that, we need to not lose the strengths of some of our vertical programs right now. For example, in AIDS, TB, and malaria. The fact that they're very results driven, there are clear metrics for success, real attention to key population, marginalized groups, human rights, lots of funding in them. I mean, we need to be building programs that are adequately funded, and they're committed to private sector and civil society engagement. Those are all values I think we definitely want to keep as we go forward together. When the Obama administration came in, you may remember they launched the Global Health Initiative. And I think that for all the great things that President Obama did, I wouldn't say GHI is the model. I mean, GHI came in and said, let's be more systems oriented and more generalized in our health approach. It did not commit to finish the job in terms of ending AIDS, TB, and malaria. There wasn't any new money that came with it. And there were so many metrics for success that it was going to be hard to know what was being accomplished. So I think what we need is a much more focused, results-oriented, and better funded effort in global health. And we can talk about what the details look like that. But let's start by agreeing to demand more money, not just work with the money we have. But I also think we need to be committed to ending the epidemics of AIDS, TB, and malaria. Loyce is part of a group that's been trying to influence all the presidential candidates to make a pledge around that. There's no health security in Africa until we end AIDS, TB, and malaria. The word integration comes up a lot when we're talking about the future of global health and the need to better integrate AIDS, TB, and malaria responses. And I think that in many cases that's going to be really good. And I would also say that we don't need integration for integration's sake. If you look again at a vertical program like HIV, there's a lot of settings in the world in which it's not going to be well integrated to a health system because HIV is unique. It has huge stigma that comes with it. It affects populations that are marginalized. Many of these folks are just not going to get the services they need in a health system, a public health system. And we need to change that over the long run. But in the short run, we're going to need standalone HIV and other responses. You're in a wonderful position being in the Bay Area. Well, first of all, I'm from the Bay Area, so I know you're in a wonderful position, but also you have Speaker Pelosi there and Congresswoman Barbara Lee as two of your champions. And, they need to hear from you how much you support their work in global health. They are our leaders, really, in Congress. And so I'm so proud to be working with them. And I think they need our support in helping rally support around investment in global. As we go forward, last thing I'll say is just also let's involve a lot of voices in our advocacy, but in our vision for global health going forward. Civil society has to be engaged in countries. We need more decision making on the ground in countries that are affected. We need to be working with advocates, with the faith community, with celebrities as advocates, and with the private sector. I will say that, at Friends, we've built what we call the Private Sector Advisory Council with Ben Plumley's support, and it's just been hugely effective in terms of, we've done lobby days on Capitol Hill, we did a sign-on letter last year, but the voices of the private sector as advocates for global health can be hugely powerful, and I would love to talk with folks about other companies joining that group and working with us. But I'll hand it back to you now. Thanks.
Thanks so much, Chris, and thank you all the panelists. This was amazing, except I'm feeling a little pessimistic a little bit, and I'd like to try to get some hope back into this conversation. Marianne, you started out in talking about, that this next decade that we kind of thought we're heading towards 2030 now is going to be a decade of putting back the pieces. Chris, you talked about the investments that we've made, and they're worrying signs that they're kind of going by the wayside a little bit. Loyce, you talked about, kind of how we were already resting a little bit too much on our laurels and that we needed to kind of rev things up. So Marianne, in the very beginning, you did talk about, had some glimmers of hope. So I'm going to turn to you. You talked of, not on the hopeful side, but kind of how this pandemic is exposing so many of the inequalities in our health system that we knew were there, but it's now like that people are understanding because maybe the playing field is a little bit more level. And then, Chris, you just talked about the private sector. So, Marianne, I go to you and I ask, what do you see as, can you give us some hope, what you see as maybe an opportunity for cross-sectoral collaboration?
Thank you so much for the question, Sarah, and thank you, Chris, for bringing up that point. I'm seeing a lot of hope. You mentioned that, I think that, and I feel the hope because on the front lines, necessity is the mother of invention. Nobody is telling civil society to work with private sector, with government. They want to do that. They are going out of their way to figure out how to solve for the problem that they see in front of them. So I do think as global partners, we have a role in helping to facilitate and accelerate those channels of collaboration that are just waiting to be joined. I'll give some example. I can't remember if it was Chris or Loyce. You talked about supply chain. One of our partners is working to make sure that women and young girls, adolescents, who need family planning products and services, many of them go to informal, what we call PPMVs, patent medicine providers, or community pharmacists. And, some of those supply chains are disrupted now with COVID. But on the ground, that people are already having conversations to help integrate the supply chains for FP products that are going to public sector or going to some of these more local providers that are in the community and really embedded in the community, and understand and to help rationalize the distribution, of these critical supplies. Folks are trying to figure out how to change factories into, to make PPE. Folks are trying to figure out how to integrate PPE into mama kits. So all of that stuff is happening. I think it's as global partners, we need to, one, identify where it exists and help to support and facilitate it, as I mentioned, but also to learn from what's happening right now. So when we're outside of this period of emergency, we don't forget about the ways that we actually, put our hands across silos, to work together, and we actually build on that. The other point I wanted to bring up is around how, as global partners, I think if we invest in people, if we invest in human capacity development, it's not, we can get outside of this debate around supporting vertical programs versus supporting health system strengthening, because it's really that human capital investments that make sure these programs, these systems, these resources, work for the long term, when they're stressed with things like COVID.
Thank you, Marianne. I've got a couple of questions for the panel. I know we're beginning to get questions in. So Vivian, thank you very much for yours. We'll come on to that in just a second. I want to pick up on Sarah's plea for opportunistic thinking and positive thinking. So we shouldn't perhaps ask this in the context of COVID, but what's the opportunity? All of us on this panel have been banging on for years about pandemics preparation and why we should invest in that. And frankly, nobody seems to be listening, because although we've had significant investments in the Global Fund, we were clearly caught off guard this time round. And so there's going to be a massive investment, as you were describing, Chris and Loyce, from the US federal funds, from Europeans, from Asia, all of it focused on how we respond to COVID-19. So what do we do to capitalize on that enthusiasm? How do we make sure that in building and investing in COVID-19, we do prepare for pandemics, and we don't lose sight of ending the 3 diseases of AIDS, TB, and malaria by 2030? So it's really a question for both Chris and Loyce.
Or Croyce, however we want to do.
Exactly.
I'll chime in. I mean, the good news is that we actually have had somewhat of a head start, right? So even though, and this is sort of making it more hopeful, I think even though we sort of thought, oh, we're fine, right? We won't go the way of an Obamacare or something like that. I think that still I credit our community, especially the community in Washington, for being willing and wanting to come together around a big new idea when maybe it wasn't as clear that was required. But as GHG would sort of poke around and ask this question on and offline, you had people like Chris and members of the PATH and other organizations you guys know, really saying, yeah, no, let's think and talk about that. And so even though, there was a question of how ready policymakers were, and we just maybe had a few congressional leaders cocking their heads and being interested a year ago, now you have a number of offices caring about what the big solution could be. And we can come back and say, well, actually, we've been thinking about this longer than 1 month, right? We've been thinking about it the past couple of years and earnestly over the past 12 months. So there's some thinking there. I think to Chris's point, we cannot lose sight of the legacy agenda. And so the way that we have been talking about it collectively is ensuring that we're building on US legacy, but modernizing that, or otherwise, I don't want to say streamlining, but there's a way to make that even more efficient and effective, the way that US global health has worked and has not worked, and being honest about that. And then beyond that, really looking at kind of the next wave of issues like pandemic preparedness, which of course should not stand alone as its own global health security agenda. I think Chris is saying it right, that TB is a global health security agenda. We just haven't talked about it that way, right? But if we can kind of like bolster what the US has been doing with actors around the world, and then add on to that some improvements to the framework that can be useful in an Ebola or a COVID or a Zika or whatever is coming next. And then beyond that, really be thoughtful about our connections, not just across health, because we can talk about health systems and bridging those silos, but there's an obvious connection to climate change, for example, when we talk about outbreaks and even in the current moment. There's a connection to economic development, right? There's a connection to gender issues beyond maternal, newborn, and child health. And so we, as a global health community, are starting to get better about reaching across not just the aisle, but the ocean to connect those dots. And that's what we as a GHC community have been discussing and as those sort of 3 starting points or pillars for a policy proposal that can take us to 2030.
Chris, do you just want to comment on that?
Yeah, well, let's do it. No, I'm all behind that. Again, I think the process Loyce is masterminding is great, and so fully in support of that. And I do want to impress upon people that many of these decisions, many important decisions will be made in May. I don't know that we'll have another bite at the apple in terms of massive interest in increasing health investment. Now we may, but we absolutely, I have it from appropriation staff themselves, do not count on getting another chance. We expect the supplemental in May to be very big, as I said, and that's our entry point. So I would encourage people, again, maybe I'm too, Washington about this, but I am just saying, if you want to be involved and push for a global aspect of U.S. COVID investment, right now is the time. That's my hope, right? For all the risks I see and I'm hearing about on the ground with the responses and the programs, I think we do have a chance to come out of this with a bigger U.S. footprint on global health investment. We'll have to see how we talk about it, right? I think it is about ending AIDS, TB, and malaria. I think it is about the policymakers understand now we weren't prepared, and that helping the world be prepared is an important, really salient politically astute line right now. It's hard to say that we shouldn't play some role in helping the world be prepared for detecting and addressing the next pandemic. And I think also there's an opportunity to think about preparedness a little bit more broadly than that, right? Ultimately we want maternal mortality down. We want vaccination up. We want more kids to be living past 5 and thriving. And it's hard to know. Also, the U.S. isn't going to be able to purchase that for the rest of the world. No one's saying that. And it's a little bit scary and a little bit dangerous to go down that road. But I do think it's a moment that, to raise the question of how do we help countries build health systems that work for themselves, that they invest more of their own money in, and that are more responsive to people in that community. I don't have the magic answer to that, but I think there's an opportunity there.
So let's go to questions coming in from attendees, and let me kick off with the first question from Viviane, which I think, Marianne, particularly goes to you. Nigeria has been responding to one outbreak after another: Lassa fever, yellow fever, Ebola. With COVID-19, the government and private sector are only now throwing significant funds to respond. And in between this, Nigeria accounts for about 1/5 of maternal deaths, and COVID-19 will make this worse. As health advocates, how do we keep attention on this important issue? And how do we make sure we're not responding, someone used the word whack-a-mole earlier, but we're not dealing to this, to that, to the other, and that we have a focus, and particularly on the issue of maternal health and maternal deaths?
So thank you for the question. I think it's not only the whack-a-mole analogy, but it's also, we shouldn't be pitting, issues against each other. I think that a maternal death, a child death, an adolescent death, a COVID death, they're all deaths. And each life is worth each life is a life, and we need to respect that humanity. We also, as Loyce said, there's health, but health is intricately wound up with education and with climate, and we need to figure out a way for us to get outside of this zero-sum game, for resources and funding and attention. And I'll just limit my comments, within health, because there's only so much pie. And, we need to figure out a way for the pie to get bigger. And we need to figure out a way where we recognize that investments, for example, in maternal health are going to have, ripple effects on child health and vaccination rates, because there will be increased trust in the system. And there will be increased economic opportunity. There will be increased, civil engagement, that will hopefully lead to better accountability mechanisms, and all of these things we need to recognize will take time. But specifically to that question is it's not it's a false choice to say X versus Y. What we need to do is bring all that we have to the problem, including individual contributions, private sector contributions, government contributions, and figure out a way that when we actually utilize these funds, we're doing so in a way that it leverages each other, it complements each other, and it has ripple effects.
Thank you so much, Marianne, and everyone on the panel. There's been one other question that came in, and there was one question that Loyce, you kindly took to writing, Jeremy, a bit, but it comes to the flexibility in spending, and it talks about the global fund and what is the flexibility there. And another person, anonymous attendee, who's just writing, like, isn't it time for the global fund to kind of even be a little bit broader and to kind of not be disease specific and to become the primary mechanisms for global health system strengthening? So I want to ask that of all of our panelists, your thoughts about that, because there's so many good benefits from having the results that you get from one disease like AIDS and malaria and tuberculosis, and having those clear results, but then less of a vertical approach is also really helps. And so I wanted to have our panelists have, this is like you just said, Marianne, about pitting one person, one disease against the other. We can't do that. So in response to this question about should the global fund shift a little bit, or what should we do, I would love to hear from all three of you.
Who first?
Go, Chris.
So, on the global fund question, it's a great question. A lot of people are asking it. The global fund's going to go through another 5-year strategy development process coming up soon, and so there's an opportunity to look at that. And I think a lot of donors agree with the point being made there. So I don't pretend to know the right answer. I'd be a whole lot more open to that idea if you told me you were going to double the money going into the global fund. If you tell me the global fund should now be a fund for health in general, and it has the same or just a little bit more money, no. This is what other panelists have been saying. We've got to grow the pie. So as advocates, we can't just water down our initiatives with the current amount of money. We have to say, people are going to die unless we get more money in global health. That's it. I would be, I think there's tensions here. There's the global fund right now. It's important to not exaggerate that, the global fund right now is the biggest funder of health system strengthening in the world. It puts about $1 billion towards health system strengthening right now. If it was to grow X% and put a higher share of that, it's about 25%. It goes into health system strengthening right now. yeah, I could see that making a lot of sense. But I would not want to lose the metrics for driving down HIV, TB, and malaria. I wouldn't want to lose any ambition there. Instead, what I'd want is a couple more Sentinel targets that would be good. A few targets that will help drive people towards comprehensive health systems for people. So I think maternal health is one of those probably, but I'm going to defer to experts to say what those metrics should be. But I'd love to see us setting up additional metrics, not a lot, but a couple more that drive programmers and policymakers towards more horizontal, primary care for people. The amazing thing is, if you'd held this webinar 3 months ago, we wouldn't be talking about COVID, we'd be talking about UHC. But there's a way in which it's the same conversation, because COVID is teaching us that we need systems that work for people, that people feel comfortable coming in to get services, and that as we ramp up for one service, we don't degrade our efforts in another area. And that we do it in a way that doesn't bankrupt families. Those are UHC values, I hope. I mean, those are my UHC. UHC is a bit of a Rorschach test, but so I think COVID is calling the question on what UHC means to people.
So I've got a question for you all, but before doing that, I just want to comment on that last question. Be really provocative and say, right at the beginning, we thought of the Global Fund being a vertical program, and many of us in the AIDS movement, and I was at UNAIDS at that point, as I think were you, Chris.
And was my boss.
Yeah, we were working together then, as we are now. But the idea of malaria and TB being grouped together with HIV was terrifying, because we were AIDS exceptionalists.
That's right.
But here we are, nearly 20 years later, and it seems to me that the Global Fund really is the only global funding mechanism that we have. PEPFAR's great, but it is a bilateral direct-to-country program. The Global Fund is the mechanism that pulls everybody together and helps every country implement. So I think we've just got to accept the fact that it's got to embrace pandemics preparation, incorporate COVID, and I think that's where the big deal is going to be. And so, Loyce, I'd love your thoughts on that.
Yeah, I just wanted to chime in briefly because I think there's been, I don't want to overstate this, so I'm trying to be careful now suddenly, but I don't think the two are mutually exclusive. The Global Fund has done has just broken so much ground in the work that it's done. I think that Gavi is similar in that regard. And you have, things like the Global Financing Facility coming up as a, similar but slightly tweaked model. And what I think I would love to see, if we can't or don't get to kind of adding more to those existing mechanisms, just increase collaboration across those. And we know that that's happening, right? We know that Seth calls Peter and vice versa from those agencies, and they probably have conversations with Mohammed in that regard. And we also know that the UN agencies have thought about this too, because they've recognized the demand or need for that coordination or collaboration. And so you did have, lest we forget, a global action plan unveiled last year. And I think there are still some challenges or questions about how exactly that rolls out. But I think the intentions were right, where you have a UNAIDS and a WHO and even a World Food Program, World Bank, and others coming together to say, okay, well, we all care about health in our own lanes, UNICEF, UNITAID, and the like. But how can we ensure that as we're working with countries and more importantly, communities, we're speaking as one voice, right? It makes sense to them. Because the way I come at it is, similar to what Marianne was saying, look, deaths are deaths. I say people are people. Don't just, they're not the sum of all their diseases. And so really what's motivating me to find some way to coordinate everything and have a more systems approach is not to make it more bureaucratically convenient or efficient. It's just to serve them the best way we can and serve. They don't understand all this stuff. They understand this, me. How are you going to serve me? And so the onus is on us to figure this out. It's going to be tough. It's going to be hard. It's going to be confusing to people in Congress who are used to certain metrics and line items. And forget all that. People are dying. People have needs, and it's up to us to meet those, however messy it is.
Marianne, would you like to add to that at all?
Yes, thank you. I think, when you break it down, and back to that other question about COVID versus maternal health, we saw in the Ebola crisis, maternal deaths increased by, up to 75%. So you can't separate, these issues. But when you break down something like pandemic preparedness, what are we talking about? We're talking about disease surveillance systems. We're talking about, making sure that we are able to get to the last mile with critical services. We're talking about our ability to inform and engage with communities in culturally appropriate ways. We're talking about the ability to be flexible and agile in getting critical supplies and essential services, to where they're needed. So those are the things that we've learned from PEPFAR. We've learned from Global Fund, and we just, I think, need to, I'd put myself in this bucket. I think we need to not situate ourselves in my own living room, but situate myself, on the ground as a person who has multiple health needs over time, different health needs over time, and how is it that we can organize the work that is being done in the front lines in a way that puts that person at the center, and gets those services, that information, as well as receives information and key data, from that person. If we can, I think we can figure out how to do it. I think that, back to this question about the opportunity and the big idea that COVID is really unveiling for us is the notion that, no one is immune, no one is safe. National borders, even geographic borders like oceans and mountains, none of that, protects all of us at all times. And so we do have, I think, this special moment in time, and maybe I'm being too optimistic because folks may say this happened after Ebola, et cetera, et cetera. But COVID really is a global pandemic, and really is something that everyone is feeling viscerally and personally. And Loyce, I think you said this in an email, your mother now knows what you do. Everybody can understand how health systems, when they are not serving everybody equally, when they're not getting to the last mile, when they're not resilient, when they're not funded appropriately, has devastating impacts, not just on health, but on livelihoods, and devastating economic, impacts that, this is the time, to really bandy all of us together around those essential services.
Thank you, Marianne. And if I may, just one final question, picking up on what Rebecca Joseph has asked us. How are you expanding your networks of partners to address the critical gaps you've identified? And I'd love to get a sort of a final comment from people, particularly, how are we mobilizing the private sector? We're all involved in it. Whether it's the Private Sector Advisory Council, the work of Global Health Council, the Bay Area Global Health Alliance, which is this fascinating blend of tech, biotech, and academia and nonprofits. But how do we expand our networks? And Chris, maybe we could start with you, and that could be a chance for you also to make your final comments.
It's been great being part of this. Thank you. I'm looking for that answer too, but we have created our own Private Sector Advisory Council to do this. I've learned that, I don't think companies want to have tons of demands put on them. Rather, what we try to do is give companies an update on what's going on in Washington with global health, and let them know of opportunities to be effective as advocates. And then sometimes reach out to them one-to-one and make particular asks on an advocacy basis. Can they sign a letter? Can they go to a meeting with us? Can they give us intel that their lobby team is getting on the Hill? And all of that has worked. And I think then also we try to encourage companies to be partners with the Global Fund, just in terms of sharing expertise and other goods. So I think there's a lot of ways to do it, and I think there's a lot of interest in the private sector in finding those ways that that they can be more engaged. So I'm hopeful there, and it's a growth area, I think.
Yes, same. GHG does have private sector members, as do you guys, but you might not know that's kind of controversial. And we are sometimes under scrutiny for that reason, although we believe fully in the multi-sector model. It's really important to us, and it's not pay to play. It is a very democratic model, so you pay what you can or what you're worth. And it allows everyone to come to the table, big and small, public and private, maybe not public in terms of government, but nonprofit and private. And it's essential, with the problems that we face. I think we firmly believe that everyone needs to be at the table in solving those. I think, though, one way to bring more people in is by obviously thinking differently about the private sector, which you all have done. And so there's not just pharma and med device companies, but there are tech companies and IT companies and Caterpillar and Unilever. I mean, these are all organizations or companies that are in the broader development space that I think we should be bringing in even more so into the health space, to the degree that there are clear guidelines for and parameters for engaging the private sector. Obviously, we don't work with the tobacco industry, other industries that are no-go, I think, for people in the public health or global health community, as they should be. And yet there's so much opportunity out there beyond some of those corporates. And all the more reason why I get excited about the health and development blend, because I think it opens that door for more actors, not just in the private sector, but across the board, frankly. So we'd love to continue having a conversation about that, because I think there are different angles that we can, or lenses that we can view this through.
Yeah, and thank you, Loyce. And just quickly, from the Merck for Mothers perspective, I think that there are two networks that I'd like to bring people's attention to in terms of how we thought about this. And one is the tech and the digital sector within private sector, and how, really leveraging those resources. It's really clear in COVID, because we're doing everything virtually, and we're trying to figure out how to give care, through a distance, remotely, and so that ability to use technology to connect with people and provide services, that's something that's top of mind, and how do we take the lessons learned during COVID again and apply them in a post-COVID world. My caveat there is not everybody has access to this technology, and so there really is an advocacy role to make sure that if this becomes the solution, it's a solution that's accessible, to everyone. And then the other group I would like to bring attention to are the local private providers, the local entrepreneurs, and their ability to really respond to the needs of their that they see in front of them in their own community and provide services. I think this is a huge sector network of people that we don't historically, or we haven't historically included in global health responses. And I think if we do, and we do more intentionally, we'll see a difference in the impact of the work that we're doing.
Well, thank you so much, Marianne, Loyce, Chris, and Ben. This has been a fascinating conversation, and it kind of goes from COVID-19, where we're all kind of having a shared vulnerability, to kind of going to what is our shared responsibility moving forward. How do we get everyone at the table? How do we create more collaborations, a bigger pot of money, all these different things, and be advocates out there? Thank you to our audience for joining us today. This is a our first kind of substantive webinar, and we hope to have many more. And we would love your feedback on what are the topics we need to be talking about, who else should we be bringing to this table, both with the Bay Area Global Health Alliance and for other webinars. So thank you again, Marianne, Loyce, Chris, Ben, and everyone who joined us today. I really appreciate it, and stay safe, everyone, and I hope we'll stay in contact. Take care.